Welcome to Our New Story, a podcast exploring the lives and voices of New Health employees in the heart of rural Northeastern Washington. Join us as we delve into their experiences, from navigating the unique challenges and rewards of rural healthcare to discovering the joys of living and working in this vibrant community. Every episode is a chance to connect with the people behind the scenes, hear their stories, and learn what makes New Health truly special.
All right, and welcome back to another episode of Our New Story. I'm your host, Jacob Daving, and we have a special guest today, Mellisa Russell. Mellisa, thank you for being here.
Thank you for having me, Jacob.
Wonderful. So Mellisa is New Health University's manager. Mellisa, I'd love for you to explain to our viewers, what is New Health University?
Oh, the university is so great. So New Health University is not only our internal employee growth opportunity, but also for our external partners. So there are many pillars to the university. And so one of those is making sure that our employees have all the training they need to be successful in their current role. And if they want to expand their roles, possibly move up into a new position or even gain some education so they can move into maybe a degreed position, that the university helps support them in those career pathways and growth, and with their daily duties as well.
Okay, wonderful. So the university is here to kind of support the educational needs of current staff.
Correct.
Okay.
In addition, we have our external partnerships with some of our local high schools, where I have the opportunity to meet with high school students, talk about those healthcare and dental careers and what kind of careers support those, such as IT or finance. And so oftentimes these students always think about the medical careers as doctors and nurses, and they don't really think about what it takes in those background positions, such as that finance. Somebody's got to be writing those paychecks and the IT that keeps all of our infrastructure working so that we have those electronic capabilities.
Okay.
So yeah,
great.
Those are exciting things.
Internal and external pathways, kind of building both of those at the same time.
Absolutely. So it's really important. I have a great passion about our rural communities. I am a rural community kid, and so it's really important for me to let our youth know that there are opportunities in our rural communities, which in turn really does strengthen our populations and allow for those community growth and opportunities there too.
Yeah. No, I think a lot of people have it in their mind, if they want to get an education or get a career, they have to leave their local hometowns. And it seems like with New Health University, that's not necessarily the case.
Correct. Yeah. And as you know, even in today's economy, that it can be challenging for these kids to have to go away to go to college. Financially, it's hard sometimes for them to be away from their families if they've had a tight-knit family. And so, it's great if we can grow our own communities. And the kids have really taken to that. I've had the opportunities to teach these kids how to interview. And so, some of those things that they're going to experience as they get out into the adult world and be prepared for those jobs.
Okay, perfect. Well, more to come on New Health University, but you did mention you're local here, kind of rural. So could you kind of give us, where did you grow up?
Yeah, so I did grow up in Chewelah. I am a Jenkins High School graduate. I don't want to tell you the year because that will age me. So I have, like I said, I was one of those students that in high school, you're trying to decide where you want to go and what you want to do. And for me, it was, I just wanted to get out of Chewelah.
Okay.
Which I think is pretty common. And when I'm having these discussions with these students, that's what you hear. But here I am. And so the reality is that, we're all itching to be adults and get out there in the real world. And then when you do, it's that awakening of, oh, what was I thinking? And but unfortunately, there was two things that happened to me in my senior year. One would be I was given the opportunity to, our high school did partner with Providence. And so they had a long-term care unit at that time. And they were offering a certified nurse's aide course. And so that's really what started me in the healthcare career, because I had the opportunity to do that. And then from there, it was like, I knew I wanted to do that, and what's next? And so there wasn't anything locally for me to pursue what I wanted to do next, which was more of that medical assisting piece. And I had to move away to do so. And so once I did that college, I was one of those that did come back. A lot of times kids don't. They do their degree, they've experienced the bigger city, and they're like, this is where I want to be.
Right.
So I guess I'm greedy. I want to keep our youth here in our community because I've seen some of these youth and how motivated they are, and I just love the idea that I can give them those opportunities.
No, that's amazing. And looking back on my childhood, I mean, I was one of those people. I had to go out to WSU, and while I loved my experiences and my education there, I didn't necessarily want to leave my family, and it was a difficult bullet to bite. But it sounds again that New Health University is kind of bridging that gap.
Yeah, so I also raised 3 kids in this community.
Okay.
Unfortunately, the university wasn't in place with New Health at the time when they graduated. So, they had to also spread their wings and leave the community. I've been fortunate that my daughter has, because she did start college when COVID started. So It was all online.
Yes.
So she's still close to home. But as far as my other son, it was, he had to be able to get that degree in IT kind of related fields.
So it sounds like that relationship between your high school and Providence was a pretty big deal in your decision making for your future career goals.
Nobody in my family had gone to college.
Okay.
And I can remember my mom, she worked 2 jobs my entire childhood. Wow. I am an only child. And I knew that we all strive to want to make our parents proud, and so I just knew that it was time to change the mode.
Okay. Yes.
We want to kind of change that model for the future, and so it was like, okay. And I knew that nursing assisting, because I did do a part-time position after high school in long-term care, was a little tough for me, to watch the aging population and the process they go through at the end of life. And so I knew that, I tried it. It wasn't really what I wanted. So, but I still wanted to work with people. I still wanted to be involved in that healthcare component. Yeah, so that's kind of what led me into going off to college and becoming a medical assistant. At the time, you did have to have an AA degree. Okay. Whereas times have changed, you no longer have to have that AA degree, and it's actually just an apprenticeship type program. Some colleges still offer those courses as well, but there's not a degree that's associated with those things.
Okay. So kind of opening that barrier a little bit more.
Yes. More, definitely a more affordable opportunity, if any.
Yes. Well, great. So since you're from Chewelah and now you've come back here, there must be some fun things to do around here locally. Do you catch yourself at the lakes? Or are you at the rivers? Or what do you find yourself doing when you're not at work?
Well, when I'm not at work, I'm working on my bachelor's degree right now as well. So, that takes a lot of my time, but everybody has to take a pause for what they enjoy. So I would say that I find myself at the lake a lot when it's possible, when the weather is nice. I really enjoy fishing. We live in a beautiful community. I've had the opportunity to do a lot of traveling with my job, and I'm always so happy to come back home because you get everything. You have the 4 seasons, you have the beautiful mountains, you have lovely lakes and rivers, and I really like to jump on the side-by-side and get up in the mountains and explore, and see the wildlife. And I myself, although I grew up here, was not a winter sports person. My mom was never really a big advocate of me being at the ski hill because I was highly accident prone, and we didn't have health insurance, and so it was one of those things that was like, they don't really go together. Yeah, and so, but my kids, they enjoyed they tried out the snowboarding school and those kind of things, and so if you're somebody who really enjoys the outdoors and the opportunities that are in us, we really, really should feel fortunate. I know that I do. It's just a beautiful.
I've said it before, and I will continue to say it. We live in a outdoor enthusiast dream. We really do.
Absolutely. Yeah, I would agree.
So why don't we take a little transition? And you've mentioned your pathway a few times, starting in Chewelah, doing that CNA program, going out to college. How did you end up at New Health?
Well, I was thinking about when did my relationship with New Health begin? Yeah. And so I have to say, being that Chewelah person, my relationship with New Health began when I was probably about 12 years old.
Wow.
And so I can recall that I became a patient at 12 years old of New Health. And I can remember, because I really hadn't had much health care, my mom took me to Tri-County Health for all my vaccines.
Okay.
I didn't have that routine care.
Right.
That was just something that at that time we just didn't do. Yeah. But I can remember the impact that I had with going to New Health for my first appointment, and how the staff, I was sick and I was afraid because I hadn't been to like a doctor like that before. It's a new experience. And, it really left a lasting impression on me. I kind of, even though I had not known what I was going to do when I grew up yet, but, I can recall when I was going through that CNA course, thinking about what spurred me into, those New Health really helped me, as a person, as a child. And so that's kind of where that started. So after I completed my degree for my AA degree for medical assisting, of course, I wanted to come back home. I missed my family, so I moved back home, and I had worked for a clinic in Deer Park. It was a very short journey, simply because I had decided to start my family. I'd married, I'd settled down, and I was back in my hometown. And so when you're in a small community, typically most organizations, people come and they stay forever.
Right.
And so I can remember thinking to myself, boy, I hope somebody leaves New Health. I hope a door opens for me for New Health. And I finally got the opportunity. It was totally unexpected. I actually came to see a doctor here at New Health to take care of me. I was pregnant with my second child at that time. And, so I had developed a relationship with the people in the clinic at that time as a patient. And I can remember saying to the RN that worked there, hey, did you know I'm a medical assistant? And that just kind of opened the pathway for me. And so I came to New Health and started supplemental. They didn't have an opening as a medical assistant, but I was like, sign me up. I'll do anything.
Get me in the door.
Because I knew it was an opportunity that didn't come around very often during that time. Yeah. And so I wanted to jump at that opportunity. They understood I'd be going out on maternity leave. But I got to do all sorts of things. So, of course, during that time, it was the paper world. So I helped with billing claims and, filing of charts. And then when that MA position opened up, I was all in. Yeah, so that is what I did over at the clinic here in Chewelah for probably 5 or 6 years. Well, it was more than that, but had some role assignment changes over the years. And so you want me to continue?
Please. So now you're a medical assistant at New Health. I'd love to know, how do you make the jump from a medical assistant to the manager of New Health University?
Oh my gosh. And so, I can remember that, we were still in that medical paper chart world. Okay. And, my job was to take care of people. And all of a sudden we were facing this new tech revolution of, hey, the government's giving us incentives to go electronic. And so I can remember, we were all gearing up to do that, and that platform, first initial platform, was dropped in our laps, and we didn't have the greatest training, and here I was working with a primary care physician, seeing 30 patients a day. Okay. And every night by 7 p.m. I was like, I can't do this. Yeah. I can't. I'm struggling. I can't do this. It's too much for me. I saw my coworkers around me just, because it's a curve, it's technology that we hadn't experienced before. We didn't have the greatest training. And I just refused to fail. Okay. So I literally printed the manual for this platform. I took it home, in my spare time, and I came back to work once I had all the knowledge, and I went to my physician and I said, check this out. And I started teaching him. And then all of a sudden we were the ones gone at 5 p.m. Okay. All of our documentation was done, and it just became easy. And so as the teams around me were like, hey, how do you do that? I found myself spending more time working with those teams, trying to teach them how to do things. And, and that kind of just led into that physician had decided that he was going to leave and go out on a new adventure for his career. And our current CEO, Desiree Sweeney, came to me and she said, Mellisa, how would you like to become our electronic health record specialist?
Wow.
And I just looked at her and I said, are you trying to fire me? Because it was like, I didn't expect that. I didn't really understand, why. And so she was like, no, you've trained all these people, and I have this many more clinics that we need to onboard this with.
Okay.
And so that transitioned me into that electronic health record specialist role. So I started customizing the program and creating workflows and working with our administrative teams and our clinical teams to make sure that everything aligned so that they could provide excellent patient care and be compliant with documentation. And so that's where I kind of transitioned into that admin role.
Okay.
It seems like a long journey, but for me, I blink my eyes and think about that it was just yesterday.
Yeah.
And so from there, I've really been fortunate that I've had a great support system. I've had some amazing managers that have really taught me how to be a professional, how to stay within my boundaries and guide and mentor others. And so I have had the opportunity to onboard 2 additional electronic health records, so 3 in my career.
3 in your career?
3 in my career, and so I learned a lot along the way.
I'm sure.
I became part of our IT team with no training. I don't know why, but the Lord blessed me with this technology mind.
Yeah.
I also love analytics. And so one of the big tasks was with the government incentives, they had a meaningful use program. Okay. And so that was just that financial driver to get everybody on board with electronic records and start meeting clinical measures, how to control those diabetic patients to make sure their blood sugars, to improve those clinical outcomes. Okay. And so that's really what speared me into where I'm at today.
How amazing. So you kind of took that extra initiative on 2 ends. You were helping out your physician and your team doing that. You were getting to go home a little later. And then that initiative kind of led to where you are today now.
Yeah. I feel very fortunate that, I was given the opportunity. I've always been kind of driven. I've always wanted to see what's out there, what's next. And so, I think it's important that you take off your shutters and take a look around you and really work towards what you want for yourself.
Yes.
Because nobody is going to do it for you. You're the only one that can do that.
Yeah. And I think you're a great example of that. You've put in the work, you've shown up. Now you're managing New Health University. It's something you're passionate about. I can clearly see that. So kind of a full circle.
Yeah. And so, it's pretty humbling, I would say, because I think back from when I started and where New Health was and where New Health is today. Yeah. And I am so proud to be part of that growth, those growth opportunities. And so I just have a lot of pride in what our organization does for the underserved communities, not only with healthcare and dental care, but also for the people of our populations that need employment. Yes. And so it's, if I can help show somebody a career and provide them guidance to improve their home life.
Yeah, that's huge. So if someone listening here is interested in getting into healthcare, whether it's, clinical or administrative, what advice would you have for them?
Don't be afraid to take the leap.
I love that.
What's the worst thing that's going to happen? You're going to be told no. And guess what? Then you take the leap again. Yeah. Because I didn't get to where I am today by accepting no.
Yeah.
You take the step back, you gain the skills that you need to get the yes. And so nobody has to hand those things to you, and anymore, everything's at your fingertips. Find your resources and I often tell people, feed your brain.
Yes. Yes.
Because I love to feed my brain.
Okay.
Yeah.
Perfect.
All right, guys. Well, I think that will start to wrap it up here. So again, my name's Jacob Daving. We have our guest, Mellisa Russell, New Health University's manager. Mellisa, thank you so much for taking your time today to come and speak to everyone. So if you haven't, please like and subscribe, give us a follow, and we'll see you guys next time.